How you doing today, Michael Turk?
I'm doing great, Rahasa.
Well, you know what? It's really good to have you here.
Thank you.
Absolutely. So, I'm curious, what was it, Turk, that led you down this path? What got you started? I think we all have a path in life, and it's interesting to see what gets us going and passionate about what we do.
You bet. Well, as a child, I had pain, and it got to the point where I nearly died 3 times when I was between the ages of 17 and 21. The doctors didn't know what was wrong, but I discovered that if I changed my diet and got acupressure treatments or learned acupressure myself, that I could reduce the pain and restore my health. And I became healthier in my 20s than I was in my teens. I got so curious about it that I decided I wanted to know more about what is this Asian medicine. So I bought every book I could back in the 70s and 80s and just started reading about it and taking classes whenever I could find a teacher. And then I had people who liked the massages that I did, so they asked me if I could teach massages. So I started teaching while I still was working in my first career as an electronic product designer. But eventually I thought it would be much nicer to see if I could start a career in massage. And people were encouraging me. So I quit my job in electronics, started going to doing massage. I then went on to acupuncture school to learn more, and thought that I could incorporate acupuncture with my massage and the moxibustion that I was doing. And that was 30-some years ago, and I just kept learning. I still go to classes. I have 2 scholars who I'm studying with. I like reading the ancient classics, and I also learn a lot from my patients because I really listen to them, and I make notes, and I find that a lot of times patients know more than the doctors or even I do about their body, but I can offer another perspective on their symptoms and how to treat it that other people don't.
Actually, that's the reason I really like dealing with you, Turk, because when I came to you with my problem, which was an extreme pain that I had, extreme pain, I'd been to 2 doctors, and you have to excuse the way I look at doctors. These guys were just guys with sharp knives, and all they wanted to do was surgery, and come to find out it was exploratory surgery at that, and they didn't know. And I came to you, and I think it took three times with you.
Yeah.
The pain's been gone now for a few years, and it has not come back,
Yeah.
But there is a time for Western medicine and Eastern medicine. How do you think these 2 interact in a good way?
Well, that's a good question. And over the years, I've tried to work with medical doctors. I think it's foolish not to use the best of Eastern medicine and Western medicine. And where I found it to be most successful is when dealing with problems associated with pregnancy, things like morning sickness and the aches and pains that come. Almost every problem associated with pregnancy can be treated with massage, moxibustion, acupressure, and even acupuncture when necessary. And the midwives who have treated my patients the Western approach, or the doctors, have often said that their births were the easiest, and I think it's because they combined Eastern and Western medicine. And it's interesting, but the National Institutes of Health, when they set up their program of studying complementary and alternative medicine, one of the first things they came up with is that acupuncture, or actually moxibustion alone, just the heating of a point on the foot, could turn a breech baby, that's where the feet are coming first, which is not a good way to deliver, and the moxibustion will cause that fetus to turn and come out head first, and it has a very high success rate that they have reported on in their medical literature.
And this is the therapy or the sessions that you're leaning towards right now, right?
Yes, I'm doing more moxibustion. I've done it my whole career, but if I can use moxibustion, I prefer to use that. Yes. Is that what you mean?
Yes.
Okay.
Now, you wrote the book, Pain's Healing Secret, which is a really
Yes.
good book on pain, by the way.
Thank you.
You wrote something recently, right?
Yes, Pain's Healing Secret I published 10 years ago. It was based on my classes that I've been teaching massage classes for 40 years. But now because of my interest in moxibustion and my research, I wrote a book called Fire Your Pain. And Fire Your Pain isn't an instructional book, but it's an informative book about the history and development of this most powerful tool against pain that I know of, which is the moxa stick. Very safe, very low chance of injury because you're just using a moxa stick and holding it over the point on the skin. So
And it's non-invasive, too.
It's non-invasive. You don't put a needle in. You don't even have to press, although I do recommend combining it with pressure, two very non-invasive techniques. And I was so fascinated by all these doctors in the East and even doctors in the West who wrote about how beneficial the moxa is. And I said, I've got to write a book on this. So I wrote it. It's available as an ebook on Amazon. And it describes the historical development of the moxa stick and how it got discovered by a French physician and eventually published in a book by a famous American writer.
So have you added your own flavor to your sessions from the traditional?
Well, I do, because when I'm working, I want to know that what I do works. So I keep very careful notes. So I have 30 years of patient records that I can go back and see what works and doesn't work. And so I fine-tuned all these techniques. They're basically in the books, and some people are taught them in school. But when you take and you learn just how much heat, for how long, and how to combine it with acupressure and going back and forth, it creates a whole new experience that I call moxibustion, because it really is a combination of both. And it's something that I've really refined. The idea is old, but I've taught many acupuncturists who have said they've never heard of anything like that in school.
Well, what makes it important about what you're saying right now is that it opens it up for being able to be taught.
Yes.
Because if it depended on intuition, even 30 or 40% intuition, it's hard to teach intuition.
Yes.
But you can teach a method with exact procedural steps, and that's what makes it really nice in this day and age.
Yes. And I think that's one of my talents, is being able to take a foreign idea and a foreign subject and master it in myself so that I can then teach it to others, and so they can be really successful. As an example, there's a point here that when I ask people, even sometimes acupuncturists, will say, how do you stimulate it? They'll pinch this way. But in my research, in not all acupuncture books or acupressure books, but there are some that say there's a more powerful way to press it. And that's the one that I teach, where I describe that you press this way into the hand, into this bone, rather than pinching it in the web. And you get much quicker and more effective pain relief of toothaches and headaches and the kind of things that this point is good for.
Yeah, I can feel a difference when I do that myself. So what is the difference between acupuncture, acupressure, and moxibustion?
Oh, that's a very good question. And acupuncture is actually like a cut. It is one of the reasons that the FDA wouldn't recognize acupuncture is because they would say it's like surgery. And surgery needs to be done by a surgeon, because we do penetrate the skin. But it's so small, it's such a thin needle, that when you take the needle out, it doesn't even bleed most of the time. It's rare for it to bleed. So but the body has to treat it just the way it treats a cut. It's got the same healing mechanism involved. So a little injury like that causes the immune system and the healing system to respond. And therefore, we use a little injury to create a big response that will then help to heal old injuries and reduce pain. So acupressure, now that's not a cut, but it's like a hit. It's like a very slow hit. You press until it hurts. Not a lot, just a little bit so that you get the body's attention, and you sustain that pressure for a while as the feelings start changing, and people sometimes feel a sensation going up the arm if they're doing it properly. Now the body, if you press hard enough, the body says, oh, there's a little pain, you've been hit, and it responds to a different sequence of healing events that are associated with compression. And the chemicals and the electrical signals restart healing processes and will reduce pain. And sometimes acupressure is more powerful than acupuncture in relieving pain. But it's really wonderful because even if I didn't bring needles and I'm out somewhere and somebody is in very bad pain, I know the points that I can help relieve their pain and get them to where they're comfortable. So it's like a hit that's so minor, it doesn't cause a bruise, but the body responds to it. And moxibustion is a whole different kind of response because we're talking about a heat response. We hold it close enough to the skin that the skin gets red. And if you take the heat away for a few minutes or more, you'll even see the redness. Now that's called a first-degree burn, when it's red but not a blister. So we can stimulate this response without any tissue damage, without blistering, or certainly third-degree burns, with just holding the heat above the point and getting that redness. And all those cells are responding to it. Now, sometimes people think that it's similar to putting a hot pack on a part of the body. But I have demonstrated over and over again that if you heat one small spot, you get an entirely different sensation. I teach it to my students, I show my patients. They can feel the chi response with a spot that you never get if you heat the whole hand, like putting it in hot water.
So are the moxibustion points the same as acupuncture points?
Yes, the points are the same. Some points are more responsive to one or the other, but they are the same. And so part of an experienced practitioner is that they will know what points to use, the different techniques. But acupuncture often is not even necessary to simply relieve pain. Acupressure and moxibustion can often do that very quickly without the needles.
You know, one of the things, Turk, is we moved here about 10 years ago, and you're one of the first people that we ran across because we heard a lot about you, and you're obviously been a success in this area. What do you think the secret to your success has been? I know the secret to our success as a magazine publisher is we've put our clients, our friends, our advertisers first.
Mm-hmm.
Our main goal is to help them, and then everything trickles down to us.
Yes.
What is your secret to success, you might say?
Well, that's a good question, and I've thought about that in the past because many people have... back when I was a massage therapist, I had a woman come in and say, boy, I really trust you, and I don't know why. I trust you more than I would trust my doctor. And I really appreciated that comment, but I also was curious, and I realized I really am interested in helping people. That's my goal in life. So I really listen to my patients, and when they tell me things about their health problems, and especially if they say their doctor said, oh, it couldn't be that, they'll say, I have this pain and I think it's it. Oh, it couldn't be that. It couldn't be this. I believe that patients actually do know their bodies, and I believe that there's a very good chance that what they're telling me is associated with it. Now, there could be other factors involved, But I really believe in listening to the patients and taking their clues to then put it into the framework of Chinese medicine, which is a holistic way of looking at body, mind, and spirit. And I found out years later that that this is being encouraged in all medical professions, and they're calling it patient-guided therapy. I still don't see a lot of doctors doing that, but it actually is a lot easier when you work with patients who are interested in their health and they want to do things, and they tell me what works and what doesn't work. Their guidance can really help me to know the best way to treat them and their unique problems.
Yeah, I've often wondered if we actually treated our bodies the same way that we would treat our cars, we would be driving around in cars until the engines blew up, and even putting tape over the idiot lights. This is how most people treat their bodies. And I think probably because of the monetary aspect, it's becoming a challenge financially to maintain your health.
Yes.
And I think we're learning that the maintenance and prevention of disease is a lot less expensive than just waiting until something catastrophic or traumatic comes up. Then you have to go into a full-fledged emergency mode. That's when it becomes really expensive. And I think the doctors and the hospitals are realizing this too. And you can only push that system so far.
Yeah.
And we've pushed it to the point of breaking. We almost have if indeed we probably do have a broken medical system at this point. It's too expensive. And even if you have the money and the insurance, there is a better way to maintain your health than what we've been doing it traditionally. I think this is why it's so important to look at complementary medicine and things like acupuncture.
Yes.
Would you like to share anything with us before we call this to a close?
Well, I would like to say I could really concur with what you said. And back in the 60s, when I realized Western medicine wasn't going to be able to help me with these crises that got worse and worse, so I realized that it had its faults. And the more I studied Asian medicine, now I know there's other wonderful medicines in the world, and I think all cultures have something to share with us. But for me, it was the Asian medicine that spoke. And when I realized how powerful it was and how you could stop pain quicker than anything else, this became my passion. Reading about it, studying it, and eventually working in it. So I saw early on that the system was failing to help people. I cannot believe that in my lifetimes I now hear most everybody talking about our failed medical system. It's Washington talks about it. The doctors are talking about it. So many doctors have written books, including a local doctor wrote a book on why what his ideas about the failure of Western medicine to help people. And what I would really like to see is all medicines, doctors and chiropractors and acupuncturists and massage therapists, working together for the betterment of the patient. And if somebody is doing something that doesn't fit into your frame of reference, but accept that it's working for them, and then simply find where you can offer and complement that. And I really am glad that we're coming into a world of complementary medicine.
Yeah, I suppose the word complementary is a good word too, because it is a complementary science that's intervening into the system. And I think as we go along, we're going to find that a lot of us are looking for different ways to maintain our health.
Yes.
And that's why this is important. Now, something, just before we go, I have a question for you.
Sure.
And this is like the investigative part of me. I've always been curious. What started acupuncture? Do you know where it came from originally?
The oldest evidence we have is actually from Europe. In the Alps, there was a man who was buried 5,300 years ago. a snowstorm came, and after that period of time where he was covered with snow, it became permanently covered for 5,000 years. And now with the recent warming, his body was uncovered. His name is Utsi. And Utsi had, several dozen marks on his body. And the scientists who first examined his body reported that they looked like the traditional places where acupuncture was done. And study by acupuncturists have affirmed that all of these points are within a fraction of an inch from where we find these same points today. Dozens of points on this 5,300-year-old body mark the same points we use today. They also examined his body and discovered that where he had the acupuncture done on his back, he had some arthritis. And they saw that he had intestinal parasites that would cause problems, and the same points on the legs were used for intestinal parasites. So who knows where it came before that, but we do know it was practiced in Europe 5,000 years ago.
Wow, that's pretty interesting.
Another thing that you said that made me think, another thought came to mind from what we're talking about earlier. I've been teaching for 40 years, and I've always tried to teach a different way of thinking about the body. Western medicine is based on scientific logic, where cause and effect is looked at, and you do an experiment, and you keep track of the results, and you want that experiment repeatable in order to discover new facts. Well, Chinese medicine had a whole different way of looking at it. Now, we know that they also could think in cause and effect, but Chinese medicine is a huge body of knowledge that's based on pattern recognition. And today, pattern recognition is being talked about as one of the latest innovations in artificial intelligence that we're programming computers. You see a pattern of information that gives you information about the whole system that you're studying. So it could be like the dashboard of your car you mentioned earlier, one light here, but then if you have another indicator over here, that would indicate something different than if you had just the light or just that other indicator. So it's the patterns of symptoms that are employed. And the Chinese medical system is a huge body of knowledge that contains all these patterns that help guide. And the difference is, when you learn to recognize patterns, is that the information just comes out at you. Where with Western medicine, you gather all this information, and then they try to fit it into a way of narrowing down to what the problem is, and sometimes they can't find with one. So the problem. And so I've had patients come to me with serious, uncomfortable problems with the skin or organs, and they no agreement on what the diagnosis was, but I could treat them because I'm not treating what the Western docs are looking for. I'm not interested in the disease. I'm interested in how the body responds to the disease. And the way the body responds to the disease tells you the body's strengths and weaknesses. So you don't have to treat where the body's doing well. You look for where the weakness is, and you support the body in its fight for disease. And that means many problems that Western medicine has difficulty treating, Chinese medicine treats easily.
Very good. Well, thanks for coming on,
Well,
Turk.
thank you.